the management of pediatric migraine, there are still a lot of unmet needs. Yes, I don't want to repeat the same things, but of course the problem of treatment is very important, because if, as I told you, we should not abandon the old treatments, but it's true that the old treatments are not satisfactory at all, because we have many children and adolescents with refractory migraines which do not respond to the available treatment. That's so I think that so what I would like to know in the future is how to treat the children with migraine, especially those who do not respond to the drugs we can use at this moment. And so another important point concerns the psychological treatment, because it is true that psychological factors have a key role in determining the severity of migraine. Not only the stress-related school is important, but also other kinds of stress, maybe related to family or to histories of abuse. So in many cases, in many children, the pharmacological treatment must be added to a psychological therapy. But so the problem is that we do not have so many evidence that psychological therapy can be effective. So, I mean, in literature, there are sufficient evidence. There is sufficient evidence in favor of behavioral cognitive treatment, but not. But we don't know anything about other types of psychotherapies, and moreover, there is. I must say, unfortunately, scarce culture among psychologists about the problems which can involve a child with a migraine. I mean, it happens not so rarely that when we send a child or an adolescent to have psychotherapy, the psychologist, after a couple of visits, certificate that the child is healthy, and so it does not need psychotherapy. But just because that psychologist maybe cannot understand the problem of migraine and what and how important the psychological factors can be. This is a very difficult question, because it's sure that psychotherapy is important, but it's very difficult to know how our children with migraine can have an effective psychotherapy. And this the culture of the psychological treatment in migraine should be spread more, especially among the psychologists, I think.